Hello and welcome to the Balancing Act Local Edition. I'm Montel Williams. We're bringing you community stories and introducing you to businesses and people who are making a difference. So let's see who's making a difference right here in your neighborhood.
On this episode of The Balancing Act, we visit NICHOS Children's Hospital, South Florida's only licensed specialty hospital exclusively for children. We'll see how they are making a difference in the lives of so many. Today on The Balancing Act.
There's so much incredible work done by nonprofit organizations right on our doorstep. Let's take a look.
NICHOS Children's Hospital stands as a beacon of hope and healing, dedicated to providing world-class pediatric care for children and families in the local community, as well as across the state of Florida.
The approach here at NICHOS Children's in terms of pediatric health care is really focusing on patients and families and bringing technology and the best type of pediatric health care here to South Florida. Here at NICHOS Children's, we have 4 key clinical programs. The first one is orthopedics and sports medicine. This is where we take care of kids, injuries, spinal cord, sports issues, those types of things. It's a great program, nationally ranked. We also have our Brain Institute. Right? So this is really where kids, have issues around neurology, epilepsy. Again, another top-ranked program here in the state of Florida, right here at NICHOS Children's. The third one is our Heart Institute. So many kids are born with heart issues, and this is a service that's very subspecialized. There's only a handful of programs in the state, right? A few more across the country. And so how do we make sure that we have that institute, that clinical program right here in South Florida for kids? The last one is our Helen and Jacob Shaham Cancer and Blood Disorder Institute. This one's really exciting because this was just named earlier this year. Cancer in kids, it's scary. And so how do we have an institute? How do we have the programs and services with everything that's wrapped around it to help the patient, the family, everything along those lines to get through some of the most difficult times? Here at NICHOS Children's Hospital, we do have a global health program. Right, this program reaches over 120 countries around the world, where kids reach out to us, physicians reach out to us, organizations reach out to us here in South Florida to bring their kids here for treatment. The global health program is needed because we do such great things here in this country, great things here in this state in terms of pediatric health care, and it is part of our responsibility. How do we share that? How do we help more kids? The more kids we help, the better, and that includes from countries from around the globe.
For 75 years, it's the only independent, nonprofit, freestanding children's hospital in South Florida and has been committed to not just treating illnesses, but to nurturing the overall well-being of its young patients.
So our history is important to us because it shows us what we can do, but it doesn't hinder us to what's possible in the future.
The Kenneth C. Griffin Surgical Tower is a 131,000 square foot state-of-the-art surgical facility built at the NICHOS Children's Hospital. It's equipped to take care of the most acute conditions to the most complex pediatric conditions. We really started from the very beginning engaging all aspects of care. Not only the medical aspect or the surgical aspect, but again, the experience of the patient and their families. We know that a great part of the care of these children include providing an environment that's comfortable for them and their parents. Great thought went into how to future-proof these state-of-the-art operating rooms. We started by tripling the size of the operating room itself. This allows us to bring our robots into the operating room, in addition adding more technology, which would include augmented reality for teaching purposes, high-level integration of all of our imaging systems and robots. We've also implemented an automated system that allows us to predictably, efficiently, and effectively manage all instruments that the surgeon would need and when they would need it, so they can provide the best possible care to our patients.
NICHOS Children's is fully capable of treating the most complex cases, offering children comprehensive care and rehabilitation in all clinical areas for infants, children, and young adults.
Juniper is a young girl that came to me through the emergency room. She had presented with really bad headaches, throwing up, and was fairly sleepy, and she was found to have a brain tumor in the back of her head, the most common place for a brain tumor in children, and she was found to have an aggressive brain tumor, and the name of that aggressive brain tumor was called a medulloblastoma.
So when I first learned about the diagnosis, I got on my hands and knees and prayed. It's gut-wrenching for someone to tell you that your daughter has a brain tumor and she has cancer, and we're going to go through very extensive cycles of chemotherapy that can affect her long term, and it's scary. Nobody wants to hear that ever, that their kid has this. And I also have another child, so what was life about to be like for him? I'm a stay-at-home mom. They're my kids. He's young too. And our whole family got ripped and separated. How I feel now outside of the hospital is beautiful. Juniper's living her life. We're being monitored closely 24/7. I feel like I can call the doctors or the nurses anytime, but NICHOS Children's is amazing with that. They're going to monitor her for the rest of her life, and that gives me comfort.
Although we've made great strides in a lot of cancer treatment, we're still working on that with pediatric brain tumors and highly aggressive brain tumors in children. The good news is that medulloblastoma specifically has an excellent prognosis. And so right now she has completed her treatments, but that doesn't mean the marathon is over for them. She will continue to need surveillance imaging. What we do with that is we do every 3 months for the first year of surveillance imaging, and then we'll go to every 4 months. But it's a bit of a marathon for these families. We have a whole program here that is committed to the care of children with brain tumors so that we can provide them not only expertise in surgical care, but also expertise in neuro-oncological care, having a school liaison help them get back on their feet and go back to school, having a social worker who can help these families get through these hard times with resources to help them pay rent if they're unable to pay rent, or place to stay if they live far away. That's why we are committed to really providing the best care for these patients in a really multidisciplinary and comprehensive way. In children, we can't forget that once the treatment is done, they have to go back to life. And school is a huge part of that. And making sure that they can thrive in school and that they're not frustrated in school, that's what I call success, is making sure that these kids can get back to normal life. Not just the tumor being beat, but also moving forward and moving on with life.
We are fortunate here in Shaham Cancer and Blood Disorder and our Brain Institute that we have actually a comprehensive brain tumor program. And we have our neuro-oncologists, our radiation oncologists, we have our neurosurgeon, our intraoperative MRIs. So we have all the program here established to actually take care of kids like Juniper and to actually give them the right treatment for their specific diagnosis based on the latest state of art in treatment of pediatric brain tumors. So we're very excited for Juniper, for her family, that we were able to cure her without the need of radiation, and hopefully she will have a long life and she will not have any sequelae from toxicity from the treatment that affect her in the future.
I've had many memorable moments here. The staff is amazing, the day-to-day staff. The nurses that come in, they all have my daughter in their heart. They all love my daughter. They go in, they paint her nails. They do so much with her. They play games, they get her out of bed. When she first came in, she would not talk to anybody. She was lab coat fear, she's scared, and when they walk in the room, she would open up to them and want to play with them all day. So there's a ton of memories from painting nails, hiding Easter eggs. We've done so much because our stay was so long in the hospital.
We have to support these families from the minute they hit the emergency room and they hear the worst news of their lives that no parent ever wants to hear, to the time that they ring that bell and they're done with their treatment, to every other time that they come to us for surveillance imaging where parents have their heart stuck in their throat and are anxious about what the results of those are. It's important that we treat every facet of these children's lives.
My experience at NICHOS Children's Hospital has been tough but amazing. Everybody here has been so supportive, and I feel like it's like the best staff I could ever want for my child.
At NICHOS Children's, we're fortunate to have incredible subspecialists spanning the gamut of medicine. And with these complex patients, it really allows us to work as a team to individualize care for all of these patients. And as a result, we're able to predictably provide exceptional care to these patients and families.
Lucy wanted to make an entrance, so she was born early. She couldn't wait to get here. She was born at 33 weeks. She was a preemie. And when she was born, to our surprise, she had 2 heart defects, an ASD and a VSD, so 2 holes in her heart. And she had some congenital differences, so she needed special care. And her cardiologist, who was overseeing her care at the time, turned to me and he said, "Do you want me to treat her as if she was my kid?" And I said, "Yes." And so he said, "We're moving her to NICHOS Children's." And so yeah, she was moved here that day and spent 2 months in cardiac ICU where she thrived, thank goodness. They watched her and she grew. She was able to go home. And at 6 months, her heart defects were repaired by Dr. Burke. Easy peasy. She was a champ. I think she spent 2-3 nights here after heart surgery and went home. And then we came back again for her 2 foot surgeries and then her leg lengthening surgery. So we are fans of NICHOS Children's Hospital.
Overall, between the heart surgery and the ones on my feet and then the leg lengthening surgery, I had 5 in total. Since one of my legs was longer than the other, I went through a lot of pain in my legs, my hips, and my back at the end of the day after walking. Also, I had to take a lot of catch-up steps when walking along people, my family, friends, in order to keep up with them, keep the pace. Before I started the surgery, I remember researching online for teen support groups or information from other teens, but I couldn't really find anything. And during the time, the whole process, I couldn't really walk for like 6 months. I had no weight bearing and it was very long. So at times it did feel very isolating. It also wasn't common, so that added another factor to it. So after the surgery and I was healed, I decided that I wanted to take what I learned and use it to help others. Because I've always been taught that service is very important. My family values it a lot, my school, my faith, so I decided I wanted to take what I've learned and give it back to those who could actually need it. So I decided to take what I've learned by writing a guide. It's called Rise Above, A Teen's Guide to Limb Lengthening. And it basically has tips and advice for kids that are undergoing the limb lengthening process and what to expect in advance and how you can make the process easier and how to not feel as alone. One of the most impactful experiences that I've had at NICHOS Children's Hospital was definitely walking on even legs for the first time in my entire life. It was mind-blowing to actually have both feet even on the ground. And yeah, I was very grateful to the staff and Dr. Baitner, the doctor who performed my surgery, because they were all amazing to me and attended to me with great care. Golf has always been a passion of mine, and before the surgery I played a lot, but I still had some difficulty with my swing because of with the evenness of my legs. But then after the surgery, I was able to see some improvement in my form and swing because I was fully able to play to my best ability, being both legs even.
I always consider myself incredibly fortunate and blessed to be able to take care of children. I think that children as a patient show incredible resiliency. Something that really sets them apart from other types of patients, when they go into a diagnosis and a treatment, the way they process it, the way they take that moving forward has so much innocence and true just grit to get better. I think that's something that we adults can learn a lot from, But with that said, these patients often have complex conditions and problems that we aim to solve, and we really think that solving these problems and helping these patients requires that we also engage the families. And part of that is because families play such a role in that care team. One of the main features of involving the family is keeping them informed and educated about what's going on and certain plans of care. Many of those plans include input from the patient and the families. So really making sure that the entire team, again, including the patient and the family, are on the same page and well educated about everything going on.
Well, after 5 successful surgeries here, we are big fans of the hospital. They are near and dear to our heart. They've seen her grow up, really, literally since from her first week when she was moved here as an infant. She's had excellent care. Now to seeing her all grown up. So it's been an amazing journey, and they've been on the journey with us, so we're very grateful.
I feel so lucky to have NICHOS Children's Hospital's care right here in my own community, and it has changed my life so much, and I'm so grateful to have it.
With outpatient centers across 4 counties in South Florida, patients can receive life-saving surgeries and continue their follow-up care right in their own community.
Pediatric healthcare has so many challenges. One of my biggest passions in terms of challenges in the industry is really around access, right? Access to care. So we can do some wonderful things in this organization, on this campus, in our outpatient facilities, but if kids can't get to us, for whatever reason, whether it be transportation, whether it be financial, whether it be anything along those lines, that's a big challenge in pediatric healthcare. We know we can take care of kids. We know we can make them better, but they have to get access to care. And so what we've done over the last decade or so is expand. So we have outpatient centers across South Florida, going over to the West Coast, getting care to where kids live that's appropriate, that we can get there, get them access to the primary care, get them access to the subspecialist, and when needed, come to the main hospital, right? But the idea is to really distribute the care to where the kids are so they can have access. We can have great care, but if kids can't get to it, we're not making the impact that we need to. The number of patients that walk through our doors that are uninsured or underinsured is tremendous. For us, it's about 70%. The great thing is, how we get paid for the treatment of the kids doesn't matter to us. Right? We take care of every kid that walks through our door. Now we do a ton of work on the back end, right, to help, and of course we do that through the processes that we need to. But from a care delivery, that really does not come into the equation. So one of the things as a Children's Hospital that is key to our organization is philanthropy. As I mentioned earlier, we are 70% Medicaid. That's a tough financial position to be in. So philanthropy is really where people from the community, donors, companies, corporations really see us as a value. And so, of course, that comes in terms of some financial assistance, but it's so much more than that. This is around how people view us, that they view us as a value add in terms of what they're going to give up their resources for the community. And so, again, the dollars component helps offset some of the programs and services we do, but I see it much broader than that, including that passion that people see for us. The history of the hospital is actually pretty interesting. We've gone through several name changes over the 7 decades that we've been here. But probably most interesting is really over the last decade or two with some of the things that have happened with Jack and Barbara Nicholas. They are super supporters of the organization, super supporters of pediatric healthcare across the country, across the world. So when they stepped up in the mid-2000s, 2016 timeframe, it really was transformational for us and for them. And so when you hear them talk around the history in our organization and what we do, Barbara always talks about the angel doctors, right? Jack talks about, the 4-foot putt that was hard. This is much more rewarding than any of those things they do. So that history, again, it helps us define of who we are and guide us on the future. We recently opened up the Kenneth Griffin Surgical Tower here at the main campus. And so we continue to invest in the main campus here. And I get asked the question why many times, right? And so this is really around how do we provide the most complex care here at the main campus. We do the care here, we do the complex care here. We do the surgeries, the high-end components, the chronic care components. That all gets done here. And as we've opened up the Griffin Surgical Tower, we've elevated that care. The innovation, the technology, the patient and family friendliness of the entire facility is above anything that I've ever seen. I like to say today, we have the most advanced operating rooms in pediatric healthcare in the entire country. Right here at NICHOS Children's, right here in South Florida. And we're doing that across all 4 institutes for every single patient that walks through our door. And we're going to continue doing that for another 75 years. NICHOS Children's is a wonderful organization. It is where magic happens for pediatric healthcare in the state of Florida, for Florida's kids, for kids that need to come in from out of the state as well, and out of the country. This is truly a magical place. This is where people, parents, grandparents bring their kids, because this is where children matter most.
To learn more about NICHOS Children's Health System, visit the website at nichoshealth.org or see the segment again on thebalancingact.com.
Thanks for joining us on The Balancing Act. We'll see you next time.